Hello, everyone, and welcome to the Wadham COVID-19 podcast. This is podcast number 8. My name's Joe Cuthbertson. And for this podcast, we're talking to Jerome Hauer. Jerome's a visiting professor at the Defence Academy of the United Kingdom. He's an associate editor of the Journal of Special Operations Medicine, and he's a colleague as one of the members of the board of directors for the World Association of Disaster and Emergency Medicine. Welcome, Jerome.
Thank you, Joe. Great being here
Great to
with
have
you.
you. Fantastic. Thanks so much for spending some time with us, Jerry. Tonight we were, it's tonight my time and morning your time, but being part of that global community, we're working together. The session for today or tonight is on vaccines, and I thought we might just kick it off with, what can you tell us about vaccines? What are they and how do they work?
Well, fundamentally, Joe, a vaccine is some form of a pathogen, viral, bacterial, or toxoid that is used to stimulate a host response against that very pathogen. There are a number of ways of developing a vaccine, but fundamentally what you want to do is take whatever you're trying to protect against, inject it into the body, stimulate a response so that if somebody is challenged with that pathogen, they do have already built up innate immunity.
I see. Are they usually 100% effective?
No, in fact, they are not always effective. One of the things we find, particularly with seasonal influenza, the antigen type that is used doesn't always match. And particularly the last couple of years, we have found that the vaccine has been significantly less than 100% in stimulating the right type of antibodies. And that's one of the reasons people will say, I got a vaccine, but I still got the flu.
I see. Are they challenging to develop? There's a lot of chatter on social media around COVID-19 and development of a vaccine. What goes into developing a vaccine itself?
Vaccines, first of all, are a long process. Vaccines go through a whole series of phases. They start out in the lab with development and then use, usually in animals, where they test the animals. They inject the vaccine, test the animals to see if they're getting a response. Are the animals developing an antibody to the pathogen that's being injected? From the animal model, you then go into a series of clinical studies, and it goes through 4 different phases. The first, you start using the vaccine in a very, very small number of patients or a very small number of people. When you think about testing it, you want to start by ensuring safety of the vaccine. So you start with 40, 60, 80 people. You give them the vaccine. You look for adverse reactions. You want to ensure that the vaccine doesn't make things worse, doesn't cause a disease, doesn't cause adverse reactions, and it actually stimulates the antibody response that you're hoping that it does. You then go into a phase 2 study, and you start doing the trial in a larger group of people, and then you start in various age groups. You start with normal, healthy adults. You start going backwards. start lowering the age, start going into children to ensure safety and efficacy. In phase 3, you start doing tens of thousands of people, and you might not see an adverse reaction in a small group of people, but when you get into tens of thousands, you might see that one odd adverse reaction that when you get into millions could be seen in a significant number of people. In a phase 4, after licensure, you're then giving the vaccine to millions of people, and you continue to look for any kinds of issues related to the vaccine. The problem with vaccines is that the process of developing a vaccine can take years. The Ebola vaccine was just licensed in December of 2019. The process for developing the Ebola vaccine began back in 2014. So we're now looking at a 4 to 5 year, 5.5 year process, and it just wound up being licensed. It is a very slow process. You've got to get the right antigens to stimulate the right response, and it can be hit and miss. So it's a time-consuming, sometimes a very frustrating process.
I see. So there's clearly a lot of work that goes into the development of any vaccine, and in the current sort of global climate with COVID-19, there's a number of agencies out there striving to develop a vaccine. Reports of anywhere up to 100 different projects that I've personally seen. Some papers released around the Oxford vaccine in London, and from an Australian perspective, we've seen reports on Operation Warp Speed in the US. What's your feel or your analysis of what progress has been achieved in this space for COVID-19 so far?
Yeah, Joe, when you look at all these projects, there are a number of vaccines being developed that have similar types of methodology for stimulating an antibody response. When you think about vaccines, you can either use a live attenuated vaccine, which is where you take the pathogen, you attenuate the intensity of the pathogen, you tone it down, you inject it, and you get an immune response. You can also do an inactivated or killed a vaccine. In that, you take this pathogen, you basically kill it, and you inject that into the body. The immune response from both of these is usually pretty strong and long-lasting. You then can look at other recombinant vaccines, and most recently, we're hearing about messenger RNA vaccines. And as you look at these 4 or 5 different types of vaccines, they're all being tried in different ways. The Oxford vaccine uses an adenovirus. The pathogen or snippets of coronavirus are introduced into the adenovirus. That is then injected, and the body starts to use that piece of the RNA to continue to produce more of the virus in the body, and that then stimulates the antibody response. And as all of these vaccines are being developed, a good number of them are going to fail. That's part of the problem with developing vaccines. You just don't, out of 100, if we get 4 or 5 that are really promising candidates, we'll be very lucky. And again, getting to the point where we know what a good candidate is could take many, many months, despite all of the hype about having a vaccine in 5 or 6 months. Is it possible? Anything's possible. But when you look back at most vaccines that can take 5 years, 10 years, having a vaccine in 6 to 8 months would be a remarkable development in the history of developing vaccines. So when you look at the Oxford vaccine, it's certainly got potential. And if it worked, it would be terrific. We have to see when it gets into large scale testing in humans, when you get into the phase 2 vaccine trials, we've got to see if there's any problems with safety. And it appears there is some efficacy, but we've got to look at a large population at the safety of the vaccine.
I see. So in the setting of that, and given the time that it takes to develop this properly with appropriate clinical quality and safety, do you think we've got a dependence on the creation and production of a vaccine to recover or make our way through COVID-19?
I don't think there's any question that without a vaccine, that it, with the nature of this virus, as transmissible as it is, and with the potential for ongoing transmission throughout the summer, and then another spike or a second wave in the fall, I think that without a vaccine, the potential for this thing burning out on its own is just, I just don't see it. There are thoughts about herd immunity, but current thinking is that in order to have herd immunity in a place like the U.S., 50 to 60%, some say 70% of the population would need to have some kind of immunity. And right now we're under 20%. In fact, one study just came out in New York State showed in healthcare workers, immunity was about 14%. In the general population, it was about 19%. So we've got a long way to go before we see herd immunity. So the need for a vaccine is really critical. Part of the problem with vaccines, Joe, is companies don't like to invest in a vaccine that nobody's going to buy, particularly in small quantities. That was part of the problem with the Ebola vaccine. To make a vaccine is an extraordinarily expensive endeavor. You're talking about hundreds of millions of dollars between development, manufacturing, years of trials. You have to ensure that at the end of the tunnel, there are customers. What the federal government here in the U.S. is doing with Operation Warp Speed is they are saying to vaccine manufacturers, we're going to pick 4 or 5 of the best candidates. And rather than wait until you get through all of your clinical studies and then tell you we're going to buy it, we're going to take these 4 or 5 top candidates. We're going to tell you to go ahead, start manufacturing, make millions of doses, and if they work and they survive clinical studies and they're shown to be safe and effective, we'll buy it. If in fact they fail, we'll still pay you for the clinical studies you did, and we'll pay you for the vaccine you've made. So there's no loss to the different companies. That's a significant difference in the way vaccines have been done in the past, where several vaccines. They're made, they go through clinical studies, they're manufactured, and only small quantities are needed. So the companies at this point won't be spending these hundreds of millions at risk. They'll know that they are covered, and somebody is going to be there to ensure that all the money they've spent will be reimbursed. And the other part of this is having 4 or 5 different candidates that do wind up going through to being purchased, getting through all the trials, getting through manufacturing. And again, manufacturing can be a problem because you can get through clinical trials. You can make small quantities of the vaccine, but getting it into large-scale production can have its own traps. It's not as easy as it sounds when you do it in the lab and you're making small batches. It's a whole lot different than when you want to make 50 or 100 million doses. So if in fact we do get 3 or 4 viable vaccines and they are manufactured, I think that's a good path, because in order to cover everyone that's going to need it, we're going to need hundreds of millions of billions of doses perhaps to ensure we have worldwide coverage. So multiple candidates, multiple manufacturers with safe and efficacious vaccine is a good thing.
I see. It's an interesting way to look at forward planning for infectious disease management. From your perspective, and lessons learned is a really important part of disaster management across any hazard. What have you seen in terms of infectious disease management for COVID-19 and the discussion around vaccines and things that we should be learning for the future?
Well, I think there's a number of things. First of all, infectious disease management. We've never had to shut down whole countries. This has been an extraordinary endeavor. The human toll has been significant. It's been devastating. And the economic toll, it is going to take quite some time to recover. We have this ongoing stress between the pull to maintain the lockdown or public health restrictions and the economic pull to get things reopened, to get the economy going. One of the things that I think that we're going to learn, and we're in the process of going through some hard lessons, we're going to learn how to better deal with outbreaks like this. It's one thing when you're in Africa and you're dealing with a geographically limited outbreak, but when you're dealing with a whole country and you're dealing with the whole world, the mechanisms, the strategies for controlling an outbreak, both, as I like to look at it, every country is worldwide, it's a pandemic. Every country is its own epidemic. And within each country, there is a mini epidemic. Here in the US, each state has its own epidemic. Country has its own epidemic. And the world has the pandemic. We've got to learn how to synchronize and better synchronize than we did with this outbreak. Coordination, synchronization of control measures, coordination and synchronization of communications between countries. I don't think that was done well. We need better coordination, synchronization between national governments and local governments. I look at the U.S. response, and I think there were two components. There was the federal response, which was disjointed, and the response between the federal government and local governments was disconnected. So I think we have to learn from all that. I also think that we need to have strategies to take a viral sequence and figure out how to get it manufactured as quickly as possible. Now, we're learning a lot with this virus. It was sequenced very quickly. The sequence was shared very quickly, and vaccine manufacturing started very quickly. But getting from the sequencing to the early stages to having a vaccine available is taking time. So I think that's going to be something critical that we're going to learn from, is how do we get from the sequence to the actual vaccine in many months instead of years. If we can get one done in 16 to 18 months, it'd be remarkable. If we got it done in 6 months, it would be a miracle.
Thanks, Jerry. There's important lessons there, and you're quite right. We need to be capturing these like any event and doing our best to learn from them so we can respond better in the future. Jerry, thanks again for your time for this podcast. Really appreciate that you've taken this opportunity to share some of that knowledge with us all. And I look forward to catching up with you through Wadham in the near future again sometime.
Sure. Thanks for having me, Joe. Good talking with you.
Okay, you take care.